Hello, everybody. My name is Michael King, and I am joined here with our surgeon, Mr. Mark Webble from Space Healthcare. Mark, you want to say hi to everybody?
Hi everyone, it's good to join you, and thank you for listening in.
Excellent. So, if you're here on this webinar, it's chances are, well, if you aren't watching it live, I know that we're going to be posting this up on YouTube and Facebook, and also up on our website. So, if you're hearing this after the time when we were live, I do want to encourage you that any and all questions, we'd love to hear them. So just feel free to kind of post in the comments below if it's on Facebook or on YouTube, and we'll be sure to kind of get back to you and answer any questions that you may have. So with respect to the actual webinar, what I wanted to do is kind of just set the frame a little bit and kind of connect with you on where you're at right now. And so the purpose of this webinar is really not to have you to decide that you're ready to go forward and have laser eye surgery, but really it's to help you to make the decision of, do you want to find out if you're a candidate? And really that's the number one focus that we always like to mention to a prospective laser eye surgery patient is find out if you can actually have this procedure done. And at the end of the webinar, we'll talk about the benefits of doing that. Obviously, everybody that comes to the webinar is able to get a 500-pound savings at our practice, but if you schedule your consult, and we'll talk about it at the end, there's an additional savings. So, Mark, before I kind of jump in here and talk about why patients choose laser vision correction, I'd like to hear it directly from you. So maybe if you could kind of just, when you're talking with patients, what do you find to be the most predominant reason why a patient considers laser eye surgery?
It's often a lifestyle thing. People say, well, is it because it's cosmetic? I don't think it's cosmetic. I think it's because it makes life easier to live. It's not a case of reaching for those glasses first thing in the morning or popping those contact lenses in. Going on holiday, many patients say going on holiday is a real pain with them having to take contact lenses, contact lens solutions, glasses, sunglasses, prescription sunglasses, backup glasses. What if they lose some of them? So these are often sort of triggers for them, and sometimes also sports. People say, oh, I do this sport and that sport, and trying to, even whether it's golf or football, they say it's a pain having to do it, especially in the rain. It's tough, and they say I really would rather not have to hassle with losing a contact lens in the middle of a football match or something like that.
Absolutely.
Or have rain on my glasses when I'm trying to hit a golf ball.
It never rains in England, does it? No, I'm kidding.
Every now and again.
So, and as you can see, to add on to Mark's point, that it's really that freedom, being able to wake up and see your alarm clock, or if you're a stay-at-home mom, and being able to hold your child and not have to fish around for your glasses and contacts, and just that constant having to put your glasses on and off and fiddling with your contacts. It takes time, and really also over your lifetime, you end up spending a lot more on corrective lenses than you do on laser eye surgery. And so I think that these are some of the biggest four reasons why a patient considers laser eye surgery. But as part of that process of when you're going through and deciding if this is right for you, definitely take the time and research and see what other people have said about their procedure, because you'll find that it really is helpful, especially with something that's a little bit different. The idea of laser eye surgery can some people can feel a little anxious about it, which we totally understand. But for patients, learning from other people and making sure that they understand that, hey, this is not something you need to be overly too afraid of. This is something that's a pretty amazing experience. I think that's the best place for a patient to start with. So, as Mark had mentioned, glasses can be inconvenient in the sense when it gets to be a little rainy, a little smudgy, and in the summertime, which we just went through, if you find that you don't have prescription sunglasses, then you end up not having the clarity of vision that you would like. In addition, if you have the unfortunate situation of breaking your glasses or sleeping on them, all of that stuff can be some of those little trigger points that cause somebody to say, you know what, there's got to be a better way. There's got to be an option for me to not have to wear these glasses throughout my life. Mark, did you want to add any points or maybe any interesting story that you've had from a patient about what was that moment that caused them to say, you know what, I'm ready to go forward and have laser eye surgery? Is there anything that stands out to you?
Yeah, I have one patient who is he was a bit older, so he was reached the reading glasses stage, and he was a biker, and he went on tour on his Harley to Europe, and he said he had had enough by the time he got back. I said, what was the big problem, Gary? He said, well, when my phone went, I would have to stop the bike, take off my helmet, take off my gloves, take off my glasses, so put on my reading glasses, read the text, respond to the text, then put my phone away, then put on my gloves, take my glasses off, put on my helmet, and then someone would reply to the text. So then I'd have to take off the helmet, take off the gloves, put on the glasses, take out my phone again. And he said it drove him potty. He couldn't. He said he had some important. He's an engineer. He said he had important texts and messages to receive. And after 3 or 4 episodes of trying to actually negotiate something on his phone while he was touring Spain, he said he'd had enough. He came back and said, Mark, sort out my eyes.
Yeah, I'm done. I've had my fill.
Yeah.
That's no kidding. And what about dryness of the eyes? Have you had patients? Do you find that you hear that patients that are wearing contact lenses and it gets to be their eyes just start getting drier, or is it more about the lifestyle thing? But have you ever had any patients complaining about their contact lenses?
Yeah, some people develop an intolerance with time, and the optometrist will say to them, you've got to give your eyes a rest. They'll give their eyes a rest from the contact lenses, which are really a hassle, especially if they like to socialize in their contact lenses. And they'll give their eyes a rest for a month or 3, and then they're back in them for a month or 3 again, and then they say, look, contact lenses are irritating my eyes again, go back to the optician. The optician says, oh, you've got new blood vessels growing on the cornea, or you've got a bit of reactive conjunctivitis, you need another break, and it goes on like this. And eventually they come to me and they say, I think I've been in my contact lenses for only 6 months, the last 12. I think it's time for me to consider this.
Absolutely. And, this is one of my favorite parts of our webinar, in the sense that it gives patients the opportunity just to have all the main questions that they've got about laser eye surgery. So if again you're watching the recording of this on YouTube or Facebook or whatnot, and you have any questions, please feel free to post them directly in the comment section, and one of our staff, our medical staff, will be able to answer those for you. So here are the top 5 questions, and so Mr. Mark Lovell, the first question, maybe if you could kind of carry us through the actual procedure. So I'm a patient, I'm laying there, and I'm kind of got myself ready to have this procedure done, and I'm laying on the bed. Tell me what happens during the procedure, and then to question number 1, what should I expect recovery time, and how quickly I can go back to work? So I'll give the floor to you.
All right, well, it depends. There are 2 different ways of doing the laser eye surgery, but essentially they involve peeling a thin layer off the surface of the eye. Sounds a bit daunting, but it's not actually too painful. We're not painful at all. In fact, we give you some anesthetic eye drops, and that's all you'd have. No needles, no injections. And then once that layer is peeled gently away, I then reshape the surface of the cornea with very high-tech, very good laser. And that reshaping creates a new new way of focusing the light, and adjust the focus as you would have with your glasses or contact lenses. The recovery, it depends on the type of treatment. There's 2 types of treatments. There's the layer can be very thin, just a skin layer on the surface of the eye, and that's called a LASIK procedure. It's quick and easy to do. It takes about 10 minutes, but your recovery is a bit slow. It takes a few days, but you can be back at work within a few days, and back at sport very soon. The LASIK procedure is a bit quicker. You recover quicker with that. Usually by the next day, you're comfortable, seeing well, and able to get back to sports and works. But there are some caveats. It does depend on what your work is and what your sports are, but essentially your vision is very good by the next day.
Excellent. And what about if a patient asks if this procedure is permanent? What's your answer to that one?
Well, where the laser is done is permanent. It can always be seen on scanners that can scan the surface of the eye and see where the laser was done, so that effect's permanent. But the eye is not just about the cornea where the laser is done. There's more structures within the eye, and those can age and change with time. So the overall eye can change, and therefore I'm reluctant to say that the laser is permanent, because that gives the wrong impression. Yes, the laser is permanent, but no, the effects of the laser do change as the eye ages, and therefore I wouldn't say that you're going to be free of glasses forever. I think that would be unfair and on the procedure and on you. But it's a good procedure, lasts a long time. And if the eye ages and you start to need glasses when you're older, that's normal. That's natural, unfortunately. We can work with that. There are solutions to that, and they might involve laser. But saying the laser is permanent, it's a tricky one because I can give the wrong impression.
Excellent. And for those of us who are watching this who are over the age of 40, I know there's a lot of different options for them, and maybe if we could comment a little bit about what happens to the eye past the age of 40 and how that affects the reading vision, and then couple that with some potential solutions to help out with that. What are your thoughts?
Well, it's a real pain when you've had good vision for many years and you start to need reading glasses. That is an irritation, and if you are in glasses already, you find they're either getting thicker or else you need another pair of glasses or another part of the glasses to correct the reading vision. So it gets more complicated for your poor optician. But in principle, we can deal with that. It's the options are depend on your needs and depend on your eye, but they can either involve some laser treatment to try and minimize that effect. It's not easy to turn back the clock to when you were 20, but yes, we can improve matters. Mm-hmm. And there's a lot of work being done. So in the future, there's going to be people are looking at eye drops to try and diminish this effect. There's also some different little implants in the cornea, in the eye itself, and there's ways to offset the correction on one eye versus the other to try to deal with it. So in principle, what I'm saying is, yes, we can correct the distance vision, and near vision requires a consultation to discuss what your options are, and as time goes on, the options with that will get better and better because a lot of technology is being developed for that specific purpose.
Excellent. With respect to number 4, I will tackle that one a little bit later. We've got a slide to talk about cost. But number 5, safety. How safe is this procedure for somebody who's kind of just learning about what laser eye surgery is and obviously having concerns? Is this a safe procedure? What would you say to them?
Well, I've done this for 20 years, so it's 21 years actually this year. It's my 21st. I'm not 21 years old, but yeah, I've done this a long time. And it's been it's always been a safe procedure, but not perfectly safe. Any surgery, it does carry risk, and we'll talk about that in the consultation. But it's got safer and safer. And now, with modern techniques and modern lasers, it's incredibly safe. It's one of the most commonly done operations around the world. And while there are risks, they're minimal, and we'll talk you through. Obviously, you need to be examined and assessed to see if you're at any particular risk for any one of them. But it's a very safe procedure and getting safer all the time.
Excellent. And again, if you are watching this recording and you do have questions or comments that you'd like to have us to answer, please just post them in wherever you're watching this, on Facebook, YouTube, or wherever it is on our website. Just feel free to post any questions you have. So I wanted to carry on and talk about just some recent research. And in case you haven't noticed, I do have a bit of an accent. I'm not from originally from the UK. I come from Canada, but you can see from Oregon Health and Science University, there was a recent study that was stating that LASIK is safer than contacts, and it really has to do with the fact that whenever you are putting your fingers in and out of your eyes, with your contact lenses, we'd like to believe that everyone has sanitized and washed their hands, but unfortunately, over time, you can kind of run the risk of a bacterial infection. And so, Mr. Wevel, what are your thoughts about that, just about the health risks of contact lenses? Is there any comment you'd like to add to that?
Yeah, I've also read studies I read that Oregon study. There's some other studies too which show that, yeah, there is a risk of infection, and every patient who wears contact lenses is aware of that infection risk because every one of their opticians will be telling them, this is how you have to look after your eyes, and this is what you must do with your contact lenses to avoid infection. So we're all aware that there is a risk of infection with contact lenses, and of course with surgery, with laser surgery, there's another risk as well. And you're quite right, Michael. The studies are showing that the lifetime risk of someone wearing contact lenses is substantially more than the risk of having an infection with the surgery.
Mm-hmm. Yeah, and again, it's kind of counterintuitive to what somebody would expect, but that's kind of what the data is telling us. And so, One of to pivot and move forward and to talk about one of the more common questions, which is, well, what does it cost? I wanted to put it in context of, what is the lifetime cost of contact lenses? So our fees at Space Healthcare, £1,800 per eye. You get by coming to our webinar a £500 savings, so it's £250 per eye savings. And when it comes, and you're kind of looking at that comparative to how much you're spending on contacts or glasses over your lifetime, LASIK or laser eye surgery is definitely an affordable option. And so if you are interested, of course, we've got outstanding financing options, which we can be able to educate you on when you come in for your complimentary evaluation. So again, any other questions about cost, feel free to ask us directly, and we'll be able to help you out. Now, this is one of our final slides we like to talk about, which is, well, why choose us? And obviously we're very biased, but here's a few different reasons why patients have chosen us for their vision care. And then coupling that, I would always recommend that you take a look on social media and just see what people are saying about us. I think we stack up quite well when it comes to this procedure. So, Mr. Mark Lovell, I'd like to take a moment now and I would love to hear your story. So, like, what caused you to get into this field and really to devote your career to helping people to see better? What's just carry us through that journey of your life, if you will, and kind of what brought you to this point. I'd love to share it.
Well, as your listeners will be, aware, my accent's also not British. My accent's I grew up in South Africa, and I studied medicine, and it was the same sort of curriculum and same system as in Britain, because the South African system, South Africa is part of the Commonwealth, and the British educational system was transposed there. So I went through medical school and looked at all the different specialities and really fancied eyes, because you can make a huge difference. And I ended up, as part of my training, or the early part of my training, you have to go off to some remote spot in Southern Africa, and I ended up in a rural hospital in a place called the Eastern Cape, and the patients would walk for days and camp outside the hospital just to be examined and to be seen. They'd get appointment dates for months later, and then they'd come in for their cataract surgery, and it was absolutely wonderful to treat them. They would be so appreciative. The next day, they were all admitted to the wards, and the next morning we'd do a ward round, and they'd be singing and dancing when we took the bandages off their eyes, and it really moved me. I decided this was a field I really wanted to get involved in, and I wanted to commit my career to improving vision. It was just, I mean, it sounds very self-congratulatory, but really to make a difference is what every doctor wants to do, and I felt I was. And since then, I've studied. I'm studied all over the place. I'm qualified in refractive surgery, which is doing away with the need for glasses. I'm fellow of the Royal College of Surgeons of Edinburgh. I've done further training in laser eye surgery and have the certificate from the Royal College of Ophthalmologists, and I've also done postgraduate education and training with Ulster University. So I have all the qualifications that you can really get in the UK, and plus I've got 21 years of experience doing this. So I've done probably over 20,000 of these procedures, vision correction procedures, and I've been thoroughly pleased with and satisfied with the career choice that I made all those years ago.
Awesome. It really is. I mean, to echo your point, that being able to, that's what I love the most about this industry, is that, the ability to see and how we experience the world, and this journey of life, I think it's an incredibly valuable thing, having that clear vision. And so for us to be able to help out and do our part in being able to give people that freedom from glasses and contacts, that elation, that happiness, that sort of euphoria that they get, a week after, and some days a day after, it never gets old. It's something that we love to do, and something that we'd be very grateful if you're watching this this video, and you're thinking about it. Really, again, the main thing is don't think you got to decide that you're ready to go forward and have laser eye surgery. Really, what you want to do is say, do I want to find out if I'm a candidate? And if the answer is yes, we'd love to invite you to come on in for that complimentary evaluation. Again, here's some nice words that people have said about us, which you can check out online. But this is the kind of the closing slide here, which is I wanted to, again, just sort of reiterate what's the next step. So if you haven't ever found out if you are a candidate for laser eye surgery, we'd love to invite you in at your convenience to our practice. There's the phone number that you can be able to kind of call us directly. And also there's our website. So if you're watching this recording, you also will get the benefit of saving 500 pounds off of your procedure. If you do have any questions about anything, we'd encourage you to give us a phone call. But again, I really want to thank you for kind of taking the time to spend with us and learn more about your vision. And Mr. Mark Lovell, is there any final comments or thoughts to somebody who's watching this, who's a prospective laser eye surgery patient? Any words of wisdom you'd be able to impart them with?
No, I just thank you very much for listening in, and I'd love to meet you and to talk to you and see whether you're suitable. And yes, there are many happy patients around the world who are enjoying the benefits of this, and yes, I'll love to meet you and talk about them.
Excellent. So again, thank you everybody for listening, and just one last time I'll say it, if you have any questions or comments, please feel to post them below, and we're really grateful for you taking the time with us. And on that note, I'll bid you a wonderful day, and thank you so much, everybody.